name is Dr. Majdee Islam, and I'm a urologist and men's health specialist, and I'm here to talk to you about Peyronie's disease and erectile dysfunction. Peyronie's disease is when a man has curvature of the penis with an erection, and erectile dysfunction, obviously, is when a man has issues with their erectile function. There is a relationship between the two in that men that have Peyronie's disease are likely to have erectile dysfunction, and the opposite is also true, that men with erectile dysfunction are likely to have Peyronie's disease. The reason that guys with Peyronie's disease are more likely to have erectile dysfunction is because with Peyronie's disease, you can have some penile shortening because of scar tissue that's built up in the penis from some kind of injury, whether a man's recognized that injury has occurred or not. That scar tissue then builds up to not allow the penis to expand with blood flow when they're getting an erection, and that not only causes the penile curvature, but it also causes the penis not to be able to dilate as well and decreases the rigidity of the erections. The opposite can hold true in that erectile dysfunction can cause you to be more likely to get Peyronie's disease, because when you don't have as rigid of an erection, it's more likely to bend and potentially cause that trauma to the penis and potentially get more scar tissue formation within the penis to cause the curvature. The important thing about both of these disease processes is they're very easily treatable, especially if you start to treat them earlier on in the disease process. For Peyronie's disease, there's treatment options that include things like conservative therapy, things like medication and penile traction or stretching exercises. There's injections, which include one called a Xiaflex injection, which then injects the plaque or the scar tissue itself to then disintegrate that plaque or scar tissue and allow the penis to be able to become more straight and allow for the length to improve as well. And then there's also surgeries that we can do to straighten the penis, which include things called penile plication, straightening the penis out, or removing the scar tissue and placing a graft in its place. For erectile dysfunction, there's also a gambit of treatment options, which include, again, medications, oral medications, generic medications, things like penile injections, as well as gels that can go inside the penis, all the way up to doing things like placing a prosthetic implant into the penis to allow for erectile function. And so the idea basically of this talk is to let you know that there are treatment options for both of these men's health conditions that are really important for you to understand that you can get treated easily and that the treatment options are at your fingertips, and to make sure that you go see a urologist and talk about this issue so that you can get it treated.